even throughout the day, like if you were to get labs done in the morning versus the evening, whether you're fasting, whether you've eaten, the values are just not indicative of what's going on. And I've had so many patients that are suffering terribly with symptoms that are affecting their life on a daily basis, get sent for a hormone level panel and are told, well, your hormones are normal. You're fine. This must be in your head because
Mhm.
everything's fine. And because your labs are normal, I don't feel comfortable treating. And this is where I just want the education to get out to women that you do not need to get hormone levels. They're kind of useless to us.
Hi, I'm Missy Macholka, the Menopause Midwife. I'm here to break down all the things about menopause and hormones that seem overly complicated, which is pretty much everything. With over 10 years of experience catching babies and 2 decades of intuitive massage therapy practice, I have spent the last few years deep diving into all things menopause to figure out why so many women are suffering and why there seems to be so much confusion about hormones and menopause. Calling on my midwifery experience and my desire to help women attain and maintain full autonomy, I will stay next to you during this life transition and help to explain the options as you step into your power and find optimal health. Today is Friday, December 6th, 2024, and I have the pleasure and honor to welcome Dr. Kathleen Brown today. Dr. Kat is a board-certified OBGYN, and after completing her residency training at the Tripler Army Medical Center, that is a mouthful, in Hawaii, she served for 12 years on Army bases across the country. She still maintains an active hospital position caring for laboring moms at Jefferson Abington Hospital in the Philadelphia area. Thank you so much for your service, Dr. Kat.
Well, thank you very much. And thank you for having me.
Yes. And when Dr. Kat isn't practicing medicine, she spends time in her garden catching live music shows, which I want to hear about at some point, who you love to see, and savoring every moment she can with her 3 amazing kids. She joins us today, though, as the medical director of Winona. You might have heard of them. Winona is a telehealth company that empowers, educates, and treats women throughout their menopausal journey. They offer doctor-prescribed bioidentical hormone replacement therapy, which for the rest of the show we'll be referring to as BHRT, and they ship it to you. They did what I could only dream of creating. It is such a cool platform. Before we hop in, though, I want to preface that we are going to have this conversation with the assumption that the listener already understands the complexities of the misinterpretation of the Women's Health Initiative study that really scared women and doctors away from HRT and BHRT. I want to take our time with Dr. Kat today to tease out some of the finer points of hormones and really learn how Winona is changing the way women get peri and menopausal care. Welcome, Dr. Kat.
Thank you so much. I'm so happy to talk to you about this today.
It's so great to have you here. When we were just chatting before we started, we have both of us a great love for midwifery care, and that was just a really fun connect. Kat mentioned that she's worked with midwives throughout the years, so sounds like she's a pretty amazing OB, and anyone would be lucky to have her.
Oh, thank you so much.
Can you start us off? We'll just get serious here real quick. Can you start us off with an overview of Winona? Basically, like what it is and why might a woman like to use it instead of, or even in addition to, her OBGYN or family doctor?
Yeah, absolutely. So Winona was basically born as an adjunct to in-person care, especially during COVID was when we were really, created, and access to care was so poor and people just couldn't get in to see their physician. And so what happened was we realized that there was this not enough care available in this space. And specifically when we look at women's health and what was available at the time, there were sites popping up to help with birth control. I mean, years ago, we used to hold birth control hostage while women got pap smears, but there was really not a lot of care offered to women in midlife. It was like all of a sudden, once we got to a certain age, we were no longer valuable or worth the effort to put time and treatment into. And unfortunately, even myself included, like even in my own training in my OBGYN residency, not a lot of time and consideration was spent on really teaching us and making us comfortable with the care of the menopausal woman. We would study HRT and we would talk about the different things, but we never actually talked about real feasible plans to really really help our patients. We were told, well, no one really uses this anymore. And so you're not going to ever use this. Meanwhile, an entire generation of doctors, midwives, nurse practitioners, we're all aging ourselves, especially in this women's health space. And I started navigating my own menopausal journey and getting into perimenopause. Around the same time, Winona was growing. The company started in California and then expanded to Texas. And our chief medical officer, Dr. Green, contacted me and said, hey, we want to move to Pennsylvania. I see you're in Pennsylvania. He contacted me through our interoffice email and showed me the platform. We met up at a conference. And the next thing you know, I thought, this is something wonderful that I think would be wonderful to participate in, because I myself was going through my own perimenopause journey at the time and hitting my own roadblocks, even physician to physician, talking to my own doctor, not getting the care I needed and not feeling listened to or heard. And so I really thought, well, this is a perfect part. As a laborist, I was only doing OB hospital care. And this was a way for me to return to doing some continuity of GYN and taking care of patients that way. We are an asynchronous telemedicine platform, meaning that you get online, you fill out an adaptive questionnaire to your medical history, that anything that's really important for us to know to safely take care of you. And if everything is good and you don't have any contraindications, your information is sent to one of our physicians in your state, and then we'll review your chart. And if you're an appropriate candidate for HRT, we start having that conversation and we will prescribe bioidentical HRT for you. So there's no having to wait. Like if you get online, you're not having to wait 2 months for a video visit or a week even. It's real time. Generally, our physicians get back to their patients within 24 hours. And then you can message your doctor. Like our patients have access to us 24/7. So if they're getting up at 1 o'clock in the morning with night sweats or getting up to pee and they're really suffering and thinking, I might need to change my dose, they can message us. And then the next time we're online, we can get that message and respond. So it's nice because there's not the wait time like you have with in-person care, or even having to schedule a video call or something like that. So a lot of patients really like the flexibility of that.
Yeah, that's incredible. I did not know about the 24-hour care, and I don't even understand the term asynchronous, but thank you for explaining that.
Sure. There's other companies popping up in the space around, with similar, mission to really make care available. Because, frankly, in person, not a lot of patients will get the care that they need if they are interested in starting bioidentical hormone replacement therapy from their in-person provider. There's just too many roadblocks. Not a lot of providers that are comfortable prescribing. They don't have the experience with it, but also, trying to find the time to get into an appointment, not having to wait for 6 months, and telemedicine is we learned during COVID that it's a great way to bridge the gap for access to care and let women get the care that they need. It can't replace in traditional in-person care because you still need to have someone examine you, right? If you're, for your annual exam, you still need a breast exam. You still need a pap smear if you have a cervix. You still need a pelvic exam. We can't do that through the computer or through the internet, right? So that's something that you still need to have an in-person provider take care of you when you need it. But for this specific niche where you are suffering, you have a symptom log and what you're dealing with your perimenopause and menopause symptoms, and you're wanting to try treatment. And if you're a good candidate and you don't have any medical conditions that would make it too dangerous or anything like that, then it can be prescribed right through our platform. So I think it's really helpful for a lot of patients.
So it's prescribed through your platform and to a doctor in your state, and then that script comes through electronically, or it just goes straight to the pharmacy for you? How does that
We
work?
have our own pharmacy that basically, so without we don't deal with insurance because there's too many roadblocks to trying to get the care you need. There is bioidentical hormone replacement therapy, available through your prescription plan and through going through a regular pharmacy. But often a lot of insurances only have maybe 1 or 2 products on their formulary that they're approving. Most of the time, those are not the bioidentical type. And then what may happen is if you want to order something that's on the formulary, you have to get a prior authorization. You might have to wait a week or so for someone to fill out another form. And it's just too many roadblocks for women to get the care they need. So when they founded the company, they realized that we really should have our own pharmacy. We should be able to make these medications and ship them direct to patients. And so that's what we do. We have an amazing pharmacy team. And so our most popular treatment option that a lot of women like is our bioidentical topical body cream, which actually has compounded estrogen and progesterone in it. That's bioidentical because most women do so much better with the transdermal through the skin forms of HRT. And so that's probably the most common one that patients choose and probably our most popular treatment option. But we also have patches available. We also have oral pills. All of those are ordered right to our pharmacy and shipped directly to the patient. So if I get a patient's chart today and review all her things, by the end of the day, I might be ordering medications for her and it'll be shipped. And then it sometimes will get to her door within 4 to 5 days.
That's a really fast turnaround. And it helps to, I mean, I love this platform because I cannot tell you the number of women that I see every week who come to me because they have gone to their MD, they've gone to their nurse practitioner, they've gone to their ND, and they have been kind of gaslit about their symptoms and told that they don't
Yes.
really need anything. And it just blows my mind that even as early as yesterday, I had
Mhm.
2 women in my office telling me that. And I
Wow.
was like, well, I see a naturopath and I'm still not getting all the care that I need. I am hearing that consistently. And I love naturopaths, don't get me wrong. And I love MDs. I love all the care options. But I think women in this space in the menopausal time, we're just not getting the care that we need
Mhm.
consistently. And then we get told no enough times, we're going to find care like Winona or like me in my office and I'm so glad we're all here. That's why I want to
Yeah.
talk about Winona, because I can't serve enough women to make a big enough difference in the world. And I love that you guys have such a big platform so you can really help
Yes.
hundreds and thousands and tens of thousands of women. It's
Yeah.
incredible because the
Yeah. And
healthy, the happier women are as we age, the better our world is, I
oh,
think.
absolutely. Absolutely. Yes. And I mean, we started, in one state. And when I joined the company, we expanded to Pennsylvania. Now we're up to 34 states, I believe. And
Amazing.
it's a slow expansion, but because every state has their own laws as far as medical licensure, but also telemedicine as well. So there's still
Mhm.
some states that require what we call synchronous telemedicine, meaning that you have to have a live video visit with
Oh, okay.
with a provider in order to use that. So that's why we're not in those states yet. Because of our treatment model and the way that, we really make care accessible to as most women as we can, that asynchronicity of it really helps so much. And I honestly, patients really like it. And it's not for everyone. Like if you're somebody who really needs to have that face-to-face conversation
Mhm.
and needs to feel like you're sitting in the doctor's office, this may not be the right platform for you. And there are plenty of other ones out there. We like competition. Competition is great because what that's doing is actually making more care available to everyone out there. And the more
Exactly.
that women have options and the more knowledge they get around this, it can only make everything better for everyone. Just
Exactly.
opening the conversation is helping, loads with really helping to expand care.
It is incredible. Oh man, we have so much to talk about. So we kind of like pop the lid off of this can, and I'd like to move forward into and kind of keep talking about Winona's approach. But as we maybe go through the hormones kind of one by one that Winona might prescribe for you, and I'd love to start with progesterone because it can often be one of the more confusing ones because of the terminology.
Mhm.
So, I'm talking about progestin, progestogens, and progesterone. That is all a very confusing bunch of words for a lot of people. And a lot of times they're used as equals and they are not. And
Yeah.
would you be willing to kind of try to clarify that for the listeners?
Sure, absolutely. And a lot of us are very comfortable with hearing some of those terms and they sound familiar because they may have been in a birth control you may have used in the past,
Mhm.
right? So most commonly when we hear the word progestins, these are synthetic versions of progesterone that have been made in a lab to help copy what our body creates naturally, which is the actual progesterone. So often when we're giving a birth control pill, it has a form of estrogen and it has a form of a progestin. And so a lot of women have experience with that, and seeing those terms like on a packet of pills that they may have taken in the past to prevent pregnancy. But the problem is that synthetic hormones don't do as well to really add back what your body is missing. So, I mean, the whole point with perimenopause and menopause, when our symptoms are starting and they're really starting to become bothersome, they're directly related to the loss of our body's natural production of its own endogenous hormones, which we have 3 types of estrogens in our body and typically 1 type of progesterone. And things get changed and morphed in our body as needed. Things get converted, but ultimately progesterone is what our body creates naturally. But the progestins are a lot different molecularly. Like the synthetic version of that hormone just doesn't behave the same way. And progestins work great to help regulate periods. They work great to help prevent pregnancy because they suppress the ovaries production. But when it comes to adding back, what your body actually needs, progesterone works much better, being bioidentical to what your body was creating on its own.
That's
Yeah.
great. Thank you for that explanation. I think every time people can hear it different ways, it kind of
Mm,
helps solidify that information. So that was a really great
yeah.
explanation. So, along with progesterone, there are several different methods of delivery. And I always find that this is a really important piece to hormone replacement therapy. There's oral, there's patch, there's serum, there's rings. There's all kinds of delivery systems. I'm sure I've missed a few there too. But the most popular from my experience is going to be the oral, the pills, the patch, the serum, and then the ring or in the IUD. Those are going to be more of a birth control, not so much of a hormone replacement. So what is Winona's approach with progesterone and delivery methods?
Yeah. So we offer two different versions of progesterone at our site. And that's, to be able to offer bioidentical progesterone. So in our compounded cream, we have a progesterone, micronized progesterone that's in the cream along with the estrogen that can be topically applied and through absorption through the skin. And then we also offer an oral micronized progesterone pill. So those are the two forms that we have found to be most effective. Generally, if someone chooses the cream and they want that method, they're getting the combination of estrogens as well as their progesterone. And our cream has two of our female estrogens. So we have three main estrogens in our system: estradiol, estriol, and estrone. And our bioidentical HRT cream has a 50-50 combo blend of estradiol and estriol. And so it's
Oh, great.
combined with the progesterone and applied once daily. So women do very, very well with that. And then if they choose a patch or a pill, typically those tend to be estradiol only, especially the ones we offer through our pharmacy. So then they'll take an oral progesterone pill. Although I have some patients that, the oral progesterone sometimes it can cause very drowsy side effects. So if you're really struggling with quality of sleep and being able to fall asleep, that can be wonderful. But I've had some patients that say it's just way too strong and they prefer to do a transdermal version of progesterone, and say they might do an estrogen patch, but then a progesterone only cream. And we will do that for patients that also prefer that as well.
I love all the options. That's really wonderful. And it really is so individualized. I had a client yesterday who she is on, I want to say 37 milligrams of her progesterone pill is 37 milligrams. And then she has a 10 milligram topical that she can
Mm,
add in because she's so sensitive. And
that's
so, and
awesome.
some women, I find that there are some people in this space who think we're really underutilizing progesterone. Some people have women up at 500, 600 milligrams. I mean, that's some of the fringy, more edgy stuff. But
Mhm.
I think that it just points to the individuality of the human and how we metabolize our hormones. We are all really different. It's like how we metabolize our calories. We're all very different in how we
Yeah.
use the things in our bodies. And I always like to mention to women, and I'd love your opinion on this, Dr. Kat, with particularly, you change it twice a week, which is weird because some days it's 3 and some days it's 4. But I noticed that there are some days that I go 2 days or 3 days and I need a new patch and I just know it. I've got all the
Mhm.
symptoms and I'm like, I need my patch sooner. And I think back, what was I doing? Well, I was sweating a lot. Let's say I had a heavy week in the gym, or I had a lot of stress in my life. I gave a lot of massages, who knows what I've been doing that week. And so I realized that I think I burn through and actually metabolize my hormones quicker when I'm under those conditions. What do you
Yeah.
think of that? Am
I
I out
think it's really possible. I have also seen, we tell patients to rotate the site of a patch just because if
of
you put it in the same position at all times, you can get some irritation from the adhesive in the patch itself. But if you rotate such into the fact where like part of the skin is thinner than another, I use the patch myself. I love it. Just the
uh-huh.
ease of having it there all the time and not having to remember it, the same time every day. But if you go on the front of the hip compared to kind of on the side where there might be a little bit more adipose tissue, that's going to
Mhm.
change your absorption rate. But also, you're right. Like based on how active you are, your basal metabolic rate can change and your absorption can change. That certainly can relate. But even if you're taking an oral pill or even if you're doing a topical cream, so many things can affect our metabolism of hormones, our stress level. I mean, our
Mhm.
if we get ill, if we get us an illness where we are just not feeling our best and our immune system is kicking into high gear and we have to fight an infection, often we can burn through our hormones faster when we're feeling sick. And so you can get this exacerbation of hot flashes and brain fog, but at the same time, you're trying to recover from like an illness, like say the flu or COVID or something similar. Your needs for the medication might change that week when you're sick. And so
Exactly. Yeah.
so many things can come into play and every one of us is unique. And the way I try to tell patients this too is that there's no one size fits all for every patient, right? Every woman is so unique. It's like trying on clothes. This is the best analogy I can come up with, right? Because not every pair of jeans, unless you're in that Sisterhood of the Traveling Pants movie, it's going to fit on everybody. We all like a different cut, a different style. We have to try things on. And sometimes trying to find the right formula for you can be a little bit of trial and error, just like going to the store and trying on clothes. Everyone is unique. And so it may be that we might need to tweak things a little bit until we find that magic formula for you that might work the best that we can.
I agree so much. There is some trial and error because we are not static beings. We're always
Yes.
shifting and changing and living life and experiencing all the things you just mentioned, stress, exercise, sickness, all the things. And so one thing I always like to bring up too with my clients as we're kind of in that phase of finding that sweet spot for the time being, I always like to recommend being really consistent though. Let's say it's a cream and they use it 2 days in a row and then they'll skip 3 days and then they'll go 3 days and then skip.
Oh, yeah.
And I'm like, please don't do that because you throw yourself into this perimenopausal
Yes.
craziness. And
Yes.
so hormones are really intense and we need to help our bodies get a consistent dosing with them as we're learning. We can go up and down for how much we take, with your doctor, with your care provider like me or whoever else you're using, but be consistent so that you're not
Yes.
creating premenopause in yourself.
Absolutely. Yes. And I think the other thing too is that it's really important for us to educate our patients that even BHRT is not the be all say all, right? So
Right.
the other piece of this is that as individuals, we need to make lifestyle changes. We need to optimize our wellness for these medications to work the best that they can, right? So I can prescribe all the medicine in the world, but if you don't do the work with really optimizing your sleep hygiene, if you don't hydrate well and really focus on, nourishing your body with water, and if you don't optimize your nutrition, then I could be throwing all kinds of medications at you and they're going to be not effective. Your body is not going to acclimate to them as well as possible. So I think that, so many of us, especially as we get into midlife, we're at the pinnacle of our career. Many of us are in, so busy caring for our children, but also caring for patients, dealing with our professional lives. And what are women notoriously good at doing? Not putting themselves first, taking
Mhm.
care of everyone else around them. And so it's really important to me to counsel patients that they really need to, like, if you look at the word like perimenopause or menopause, like think about the pause being a positive thing. This is like your red flag to turn that attention inward and really focus on yourself, really optimize your wellness so that you can be the best version of yourself. And then any treatment that you might seek is going to be so much more effective if you can really take the time to put yourself first and give yourself that self-love and really pay attention to your body and what it needs to be to function its best. I think it's so important. And we don't do that enough. I think that women are very good about taking care of everyone else around them and not really focusing on themselves. And we feel guilty because we think it's selfish, but it's absolutely not. It's so very important and vital to our wellness.
Preach. Yeah. I mean, it is the thing that we all need to hear. And one of my fun hacks for putting ourselves first with at least our physical bodies is getting one bead of sweat. And
Mhm.
it's the simplest thing. And it was something I heard probably 10 years ago. And I was really struggling with some thyroid issues. And one of the things I knew I needed to do every day was move my body and get to one bead of sweat. And so I went to the gym. I was like, I can do that. I can get one bead of sweat. And I was like, how long does it take me to jog on the treadmill? Because I wasn't running at that time. I was just kind of jogging to get one bead of sweat. It took 7 minutes. And I was like,
Mm.
everybody has 7 minutes in a day to try to find that bead of sweat. So everybody's different how long it takes you. It might take you 1 minute, it might take you 3 minutes. But that habit changed into a daily, or well, 5 days a week in the gym routine where I am now building muscle 5 days a week and really super healthy. But I was really, really sick for a while until I did that. And it
Mhm.
really jump started me. And so I really like to encourage women to keep that mantra in your head, one bead of sweat, just get it every day if you
Great.
can.
That's great.
We feel so much better when we
Yeah.
do it too.
Well, but even
And
small changes too. I think that a lot of us have this like all or none thought in our mind that
Mhm.
if we don't have all the perfect workout gear and we don't have the time to go to the gym 5 days a week and do an hour-long workout, then why
Right?
bother? It's like if you can't do it, I'm just gonna just not bother. But it could be something as simple as parking further in the parking lot at the grocery store, taking the steps instead of taking the elevator. These little moments of movement throughout your day, they add up and they're so very important to your wellness. And especially taking menopause aside, like as we age, we need to keep our bones healthy. We need to keep our strength and we want to be vital and active. I don't want to be that 80-year-old woman who can't get off the chair without help. I want to be independent. And I want all my patients to be too. We don't need to go gently into old age. We need to fight it.
So true. Well, now that you brought up bones, I think we really
Yes.
need to dive into estrogen, which is, to me, it's like the bone savior out there. And so, can you talk a little bit about estrogen and your thoughts about it?
Estrogen is our powerhouse, right? So as women, it is something that makes every tissue in our body function at its best and healthiest. So we know that estrogen helps, to combat these symptoms, but can also help with our brain health, help to combat brain fog. But we know now there's more and more research coming out that taking estrogen supplementation after menopause and the decline of our body's own production of estrogen actually can help thwart off dementia and development of that and lower our risk of
Mhm.
Alzheimer's. But specifically, like our joints, our bones they function better. They tend to maintain their strength more with estrogen circulating in our body. And no other part of medicine where, when you think about care of patients as a big global whole and like a public health forum, if there was anything else in the world that would help prevent significant morbidity and mortality, everyone would have the treatment available, right? But because it's hormones and because there's this fear, so many people are afraid of it. But estrogen has so many benefits to keeping our bones healthy, help to prevent, bone loss and osteopenia and osteoporosis. But also it's cardioprotective as well. Like our blood vessels that are feeding the heart tend to stay healthier, more elastic, more supple to provide that needed blood flow to the heart muscle. And so we are at lower risk of having a heart attack if we have estrogen levels circulating regularly, even as we age, compared to women who don't have it, have a much higher risk of having a heart attack as they age.
You spoke to my heart about, I mean, I think HRT, specifically BHRT, is prevention, and we
Yes.
should be using it as preventative medicine. And right now, as it stands, HRT, BHRT is for the privileged at this
Yes.
point. There are so many women in our country and in the world who could not touch this stuff. They
Mhm.
just do not have the ability to get the care to get it. So that kind of slides me into, there is over the counter birth control at this point, which
Yeah.
is synthetic hormones, which have a risk profile that's pretty significant. There is no over the counter patch. And I think that is the lowest hanging fruit for all
Mhm.
women. The lowest dose of the 0.025 available to women in the drugstore. I know that's radical, but that is my heart, is to find a way to get that to that point in our country, because really every woman who's perimenopausal should be able to walk into CVS, Walgreens, wherever she wants to go and pick up her patch and pick up her progesterone or cream or serum, whatever way she wants to do it, all in the lowest doses. And then if she needs more, she can connect with a care provider. But every woman
Yes.
deserves, in my opinion, the very base hormones, because that is what we're built with. Like it's
Mhm.
nothing extra. And nobody feels good on too much estrogen. Nobody's
Right.
going to overdose on estrogen on purpose.
There's like a safeguard in place because when you get
Yeah.
too high of a dose, you get side effects that are just really not comfortable at all. The breast tenderness, bloating. So, I mean, we can generally tell right away when we've gone too high on the dose, and patients will let us know right away. I mean, I'm sure you see
Mhm.
that in your practice too. I mean,
I do.
I've never had a woman stay on too high of a dose when she didn't really need it, because they will be right at our door letting us
Yeah,
know.
I know.
Yes.
Yeah, and so that's my like, I keep wondering, I'm like, "Okay, what point are we gonna get the over-the-counter patch?" And progesterone at, 100 milligram capsules, I mean, if you take too much, you get sleepy and weepy is what I like to say about progesterone if
Right.
you have too much. And so, I mean, goodness sakes. Okay, if it was a male product, and I won't go down that rabbit hole, but I know, we
But
all
it's so
know,
true. Yeah. I mean,
right?
that's
It would be
it
at the
just
drugstore.
it's very it's like a, a reflection of our society as a whole being very paternalistic, but also the medical profession as well. And we don't need to get into the politics of how women's health is just not valued. Obviously, as things are changing in our political climate too, I do feel like if you had women in leadership, women who themselves have suffered through and have experience with this, then the dialogue would be different. The conversation would be different. Something else we're doing, I mean, I think our founders of the company would be really happy for me to talk to you about this too, is that Winona also has a program for corporate wellness that they're
Oh,
offering companies as far as like trying to help come in and educate, because really this menopause itself is like an epidemic that can affect productivity in the workplace, and especially in corporate America as well. And if you don't take the time and the space to really address that and give your employees the time and the space they need to get the care they need, then overall it can really affect the productivity and the profits of a company, that kind of thing too. We finally have gotten to a place where most big companies offer maternity care and paternity care and adoption care. But this is a huge transition. And just like when we went through puberty and just going through pregnancy and postpartum, going through perimenopause and menopause is a huge transition in our lives that deserves attention and deserves the care that it needs. So, that's something that like companies that are more progressive are starting to pay attention to that, realizing that when a woman comes to that point in her life, it's going to change her needs as a patient, but also as an employee as well. That's a huge thing too. And it's just about education and options. And I think, companies out there have realized if they start to notice, if they start to offer wellness incentives and offer people discounts on their, insurance premiums, if they have like a gym membership or something else. I mean, this is kind of goes along with the same goals, same outreach basically. I think that it overall helps the overall health of everyone, and everyone gets better for it.
absolutely. That is so great. I do remember seeing that on the website. So thank you for bringing the corporate wellness
Yeah.
up. That is really a wonderful option for companies. One of the things I just want to transition a little bit into testosterone. And I was just wondering, does Winona offer testosterone if someone needs or wants it?
Well, so we have an indirect way of providing testosterone. Because testosterone is treated like a controlled substance in our country, it's treated like it's a narcotic, like a highly addictive narcotic. And because of the way that the politics work with the FDA, it's not FDA approved for women, right? So every time we use it in our female patients, it's like an off-label usage as well. Because of the laws of telemedicine, there's some limitations to being able to prescribe testosterone directly. So the way that we provide testosterone is actually by giving a precursor hormone that then converts in the body to testosterone. And so that's DHEA. That's why we utilize DHEA as an adjunct to the BHRT. So we start off with low doses, and DHEA, basically when our body metabolizes it, it breaks down into estrogen and testosterone. So it's a gentle, safe way of helping to try to boost somebody's testosterone level. But I do have patients that occasionally will still need more and that don't
Mhm.
respond as well to just taking a DHEA supplement. And so sometimes they may have to, take something additional. We don't provide it through Winona right now. So they would have to seek in-person care just because of those, limitations with the way you have to prescribe testosterone. But I think it's important to be part of the dialogue too, because I think a lot of women don't realize that as women, we still have significant levels of testosterone circulating in our body. Everyone thinks of it as a male hormone, but men have estrogen that's circulating just as well as their testosterone. And we have testosterone circulating along with our estrogen and progesterone. And the interesting things about our amazing bodies is that our body, when we're at our peak, in our prime, it converts these hormones and utilizes them as it needs to. But when we're going through this huge transition in midlife, we no longer have those hormones available for the conversion that's needed. And the production overall everywhere is down. That's why the supplementation with bioidentical hormones is so helpful to get us
Yeah.
feeling better and to combat those symptoms. So
DHEA is actually one of my very faves. If we could talk about that for just a moment, I think delivery system with DHEA is key. And I think DHEA gets a lot of bad rap. Sometimes you'll hear people talk about it and kind of rip on it and say, oh, it's worthless, blah, blah, blah. Well, one of the things I've learned about DHEA is that if you're going to take it orally as first pass, I have not seen it work well for women. There is transdermal, which is like a cream. And then I have one from Quicksilver Scientific that goes under your tongue. So it's submucosal. I'm just wondering, what version do you guys use at
we
Winona?
primarily use an oral
You
capsule,
do use an
basically.
oral. Okay.
We do.
And you're seeing good results with
We
that?
are. So not every patient responds to it as well, but I've had this conversation with our pharmacist because I've had so many patients want a transdermal method. And when they've looked at the absorption of it, depending on what the vehicle for a transdermal, medication is, sometimes it just doesn't get absorbed as well as the estrogen and
Mhm,
progesterone does. I've had a lot of patients come to me that have been previously taking like vaginal DHEA as well. But the problem
mhm.
with a lot of vaginal hormones is sometimes you're not getting the systemic absorption as
Right.
well. It's working mainly locally. But most patients do really well with it, with the oral capsules that we have. I've seen a lot of different oral DHEAs on the market, and I have a lot of patients that take it as a supplement. But anytime you're taking a supplement, you really have to look at where you're getting it from. So
Mhm.
there are some wonderful vitamins and supplements and herbal products available, but you really have to research where it's being made because these things aren't modified or regulated. Like they're not under the same scrutiny like as a pharmacy that's making
Mhm.
medication. And so like you want to have a reputable brand that you trust. You want to know like what's their process. Because I've seen tablets of DHEA that patients have been taking and they're like, it's not really doing anything. We have a place that's manufacturing our capsules for us and patients do very well with it. The capsules really rapidly absorbed. So the medication starts, I think in my mind, and I take our version of it as well, it's starting to get absorbed as it's kind of getting through, even before it goes into the stomach. So I think a lot of patients tolerate it pretty well, but every
So
woman's
is
different.
it
Like
more of a sugary kind of pill then? And so that it's kind of absorbing on the way down?
it's, yeah, like it has a little capsule that's basically broken down. So
Mhm. Okay.
yeah.
Yeah, and I think, transdermal is great too if you can get a hold of it and if it's absorbing right. I don't know if you've ever experienced the submucosal or the mucosal with Quicksilver Scientific. My dear listeners, if you are going to buy something over the counter, please reach out to me for Quicksilver Scientific so I can help you kind of figure out how to use it and use it well because DHEA is powerful and it's
Mhm.
amazing, but you want to make sure that you're using, like Dr. Kat said, a really high quality one because it is powerful, or you can get something that has no real effect at all because we don't even know what it is. So
Right.
make sure that you're reaching out to Winona, to me, to your care provider to get a good form of DHEA. But thank you. That's really fun. I love talking about DHEA. It's one of my very favorites. And I love that it's just so easy to understand in the hormone cascade. You have DHEA and then you have estrogen and you have testosterone. So it just wakes those things up. All the testosterone we have in our body is made, or a lot of it is made from our adrenal glands. So even though our ovaries might have gone to sleep, our adrenal glands are still awake. So we can still stimulate
Yes.
those with our DHEA. And so
Yeah.
it's a great choice.
The other thing that might be important to talk about too is that
Yeah.
I think that there's a lot of companies out there that are popping up because women are demanding more, wanting more. So many places are offering various forms of hormone testing. And I think that's
Mhm.
important to touch on too.
Yeah, let's talk about it.
This is something that, is very easily treated with a symptom log. And actually, your symptom diary is so much more useful to me as a menopause provider than getting labs. This is not the same as like checking iron levels and repleting low iron. It's not the same as your thyroid hormones. Our female hormones are so dynamic and can, like we talked about earlier in our conversation, can respond to so many other changes in our metabolism in our day and how well we're doing. So even throughout the day, like if you were to get labs done in the morning versus the evening, whether you're fasting, whether you've eaten, the values are just not indicative of what's going on. And I've had so many patients that are suffering terribly with symptoms that are affecting their life on a daily basis, get sent for a hormone level panel and are told, well, your hormones are normal. You're fine. This must be in your head because
Mhm.
everything's fine. And because your labs are normal, I don't feel comfortable treating. And this is where I just want the education to get out to women that you do not need to get hormone levels. They're kind of useless to us. The
Right.
only time that hormones are really good to be followed is when you're taking an actual testosterone supplement, making sure that we monitor that really closely,
Mhm.
just because it can be easy to be super therapeutic for a woman with testosterone and cause masculinizing side effects.
Mhm.
But we don't need to do that with the DHEA because it's a safe conversion in the body. We don't need to follow those levels. And you don't need to follow estrogen levels or progesterone levels, especially when you're taking HRT. We can know how well you're doing based on how you're feeling and how your symptoms respond. I want women to stop wasting money on the dried urine hormone testing and the salivary hormone testing. And I had a patient the other day wanting to know if she should send her hair in to be tested. And I was like, no, don't do it. Don't waste your money. But unfortunately, just as we're trying to make really reputable care available to more women, there's also those people that are out there to profit on our misery, right? And they're out there to try to make a buck with a new supplement or with a new hormone testing. And patients that are desperate for relief will try anything when they're getting the no answer with their in-person providers. So I think the most important thing is to educate yourself as much as possible and just know you don't need to get hormone tests to actually be able to be a candidate for treatment. You don't need to do that.
Agreed 100%. And I mean, just to go off of that, I think that what I've seen is I'm just going to make up a number here. 90% of women can get started without hormone testing, or maybe 100% could get started. 100% of women with a good profile and whatever can get started. And then if you're not seeing the results you need, then maybe down the line, some testing could come into play if you have something interesting going on and
Mhm.
you're trying to, and you need to dial in your hormone replacement. That's when the test could maybe be helpful. And then you can dial in which test you need. So you're not just throwing money at all this testing. Because I've seen that too. I've done that myself because I used to think you needed to be tested to figure all this stuff out. And then the more I deep dived, the more I realized that the symptoms always matched the treatment that was
Right.
needed. And that was where I was like, oh, this is the gold standard here, is really
Yes.
symptomology. And I think the faster we move to that for women, the faster we're going to find hormones as preventative care, and
Yeah.
it's going to start being labeled as that eventually. I don't know how far we are from that, but I'm going to keep hoping and keep pushing that way.
Another thing I think should be available over the counter is vaginal estrogen. I think that
Absolutely.
I wish
Absolutely.
it was like readily available. If we could teach every provider out there that didn't feel comfortable with HRT at all, just one thing,
One
it would be
thing.
to freely give vaginal estrogen to every woman and to prioritize a woman's sex life too. I mean, I think it's so very important.
And not only their sex life, but their urinary health, their urinary tract. I mean, the prevention that happens with vaginal estrogen for UTIs and recurrent UTIs is astronomical. Do you know who Dr. Kelly Casperson is?
Oh yeah, yeah,
Yeah.
absolutely.
So she's a urologist and she has a great and really fun podcast called You Are Not Broken. I'll always give her a shameless plug. But she has said, and I love this, she's like, I wish somebody would do the study where they have a nursing home and they give half of the women vaginal estrogen and half of them not. Right then and there, you will see the UTI outcome.
Oh yeah.
Nobody's ever going to do that because I guess it's unethical. Probably. I don't know about studies very much, but it's also nobody's going to make money on it. But
Yeah.
clearly, why are we not doing this for all women who need or want it? I
Right.
just don't
Exactly.
understand. The risk is not there.
It's a knowledge gap, but it's also fear, fear mongering as well. I mean, even patients, there's another physician who uses her platform online to help with education as well. And she
Mhm.
herself is a breast cancer survivor who's a huge proponent that even if you have a history of breast cancer, you have a candidate for vaginal estrogen
Mhm.
because the medication is just locally absorbed and there's very little systemic absorption, but it can help
Mhm.
replenish the vaginal tissue so much. Her name's Dr. Corinne Men, by the way.
Oh, yeah.
I
Yeah.
follow Dr. Casper Peterson, Dr. Men. Like I follow all the accounts of all the people that are doing the education in the menopause space because I think it's so very helpful. And I'll share it with my patients because I have a professional Instagram too, just trying to share information with people because I think we're all better for it the more we share this knowledge. And the more that women learn, I mean, knowledge is power and it's just so helpful. But
It
yeah, I mean,
absolutely
women,
is.
especially as we age and the nursing home women, like you mentioned, so many women end up succumbing and dying from urosepsis, which could
Yes.
totally be prevented from vaginal estrogen treatment, which is insane.
Insanity. I can't even, it's the easiest, lowest hanging fruit that there is. So I'm
Mhm.
so, so glad and grateful that you brought that up. And I do want women to know too, like with sexual health and with vaginal dryness and itchiness and discomfort, there is over the counter estradiol, estriol, DHEA for those areas. I carry 3 different products that I really like. And I always remind women if you're gonna do that, you've got to kind of do a loading dose. You got to do it kind of, I always say every time you go potty with the over the counter versions because they are lower dose and you plump those tissues up and then you're not like sandpaper down there anymore. And it is really fantastic. So don't suffer through sandpaper vagina, please.
Yeah, not
Um,
necessary.
it is not necessary. I wanted to ask you just kind of some of the nuts and bolts of Winona. Like, is there a monthly commitment? Is there a cost to begin working with Winona? Kind of, could you give us
Oh,
some of
yeah.
those little nuts and bolts?
Yeah. So actually to go onto our site and to do our onboarding questionnaire, which is like that medical history questionnaire,
Mhm.
all of that is free. And
Oh,
there's countless there we have a journal section of our website that is just free articles that have been written by our medical staff and curated that is all free for patients to access. There's a lot of things in our resource section too, which are also free for patients. Like we have a symptom diary, we have some other things that are available on there. So if you just want to check it out, you just go to winona.com. There's a lot of information out there. But once you get matched up with a doctor and they review your medical history, that's where the costs come into play. All that you need to pay for is actually the cost of your prescriptions. So we found, I mean, there's a lot of platforms out there that'll cost like that have an initial introductory free fee to have your information reviewed, or like a platform fee. We realized that no, like you really should only be paying for something that you're actually getting. And so really you're just paying out of pocket for the prescriptions.
oh,
And although we don't work with insurances, we do accept the FSA and HSA cards. So without having to deal with, restrictions from your own insurance's formulary, being able to prescribe the bioidentical HRT for you and get it directly to you, you pay out of pocket, but you can also submit it to your insurance. I've had a lot of patients be able to submit their receipts and get reimbursed by their insurance. You can do it that way, but that way you're getting the medication. You're not waiting for weeks for someone to approve it or having to jump through all those hoops to get it, which is great. And so messaging your doctor, free. All the part of that is like free
wow.
access. Only thing you're paying for is the prescriptions themselves. So
That's incredible. So is it possible to give like a range of what that might cost a month for a woman just so that the listeners
yeah.
can have an idea?
So I think our most affordable option is the compounded bioidentical cream.
Mhm,
And so if you end up doing that, you have the option we typically put a lot of patients on an auto refill program so that
mhm.
way they're never running out. They're not having to wait for another shipment. It gets sent a little bit right before you're going to run out of your current bottle. Typically the combination estrogen progesterone cream is about $89 a month. And then if you wanted to go for 3 months, I want to say it's like $219 for the month. But then we also have patches and pills because the patches are manufactured, we don't make our own adhesive for the patch and that kind of thing. Those are probably the most expensive option, but I still have a lot of patients that prefer it. We also have a product that we use that's for, female sexual enhancement as well. We have a product called Blossom, which a lot of providers may be familiar with, like a Scream cream, or you may have used that or had compounding pharmacy near you that had that. But this is something that's applied to the clitoris, to help encourage blood flow to the area, to help improve, experience and ability to orgasm. So we use that as well. We also have
Awesome.
vaginal estrogen cream that's available. And now the latest thing that we have available is a topical face cream that has a combination of estriol and tretinoin for, improving
Oh,
cellular turnover, reducing fine lines and wrinkles. And the nice thing is that as a doctor and a patient at Winona as well, like I got to try it when it first came out. And already like my skin is so much better. It's wonderful.
your skin looks amazing.
Yeah, thank you. But all of
Yay.
that is all the products that we offer, it's free to look at all the options, all the price lists, and all the ingredients are right on the website as well. So if a patient just wants to check it out and see what we have available, all of that is free knowledge for patients to look at.
That is wonderful. Thank you for being so transparent about all of that. And that way people just know, can I afford this? Can I make this happen? And how do I get it into my budget? Or can I send it into my
Right.
HSA?
Yeah.
And that's awesome. Was there anything else? I mean, you and I could totally riff for so long on all of this stuff. And I know everybody says that on podcasts, but it's really true. I'm like, oh my gosh, I could do so many things. But we're coming close to our hour and I just want to respect your time. And so, was there any last thing that you wanted to catch before I ask you my very last question?
No, I mean, I think that the biggest take home point that I like to say in any podcast and interview that I do is just to empower women to take back power over their health, right? I think that there's a lot of allegiance and like blind trust in our providers, especially if they delivered your babies or you've been going to see them for years. But when it comes to this very critical point in time of your health, if you go and armed with the information and with your symptom log and you're just given roadblocks and you are not listened to or heard, it's nothing against your provider. They might be a wonderful doctor, nurse practitioner, midwife, but if they can't hear you and come together on a conversation with this, don't ever be afraid to just flat out ask them, are you comfortable talking to me about this? Are you comfortable treating? And if they're not, it's okay to ask them, well, who would you refer me to? And if they don't have an option, then you can come to a site like ours. Like that's why we exist.
Mhm.
But I think that, I want women to feel empowered with knowledge. I want them to get all the information that they can, because this is something, then this is your life. This is your body. We only get one of them, right?
So
And
true.
I don't want women to feel gaslit. I don't want them to feel like nobody is available to help them, because it's just frankly not true. But the only way things are going to change is if we demand better and we ask for more. And if we don't get the answers we need, we go and get another opinion until we get the help that we need. And I think it's so very important that we feel empowered to do that. So I just want women to realize that.
Yeah, couldn't have said it better myself. Thank you for that. That is beautiful. And my very last question that I like to ask, because it's just kind of fun, is if you were stuck on a deserted island and you could only have 3 to 5 products, medications, or items for your body, supplements, what would they be and why?
Ooh, well, I don't think I'd want to go anywhere without my estradiol. For sure. The other thing that is so very important to me, as a disabled veteran myself and having some orthopedic issues, I also take a turmeric supplement daily, which has been such an important anti-inflammatory for my own wellness and health. And so I really recommend that. I also take vitamin D regularly, which is so helpful. So as far as medications, but I also would need like a radio or some source of music.
I love
Something.
it.
Yes.
Okay.
I don't know. I think I would have a hard time choosing only like 4 or 5 things. I think that
I
I would.
know. I know it's a mean question for sure. But I
Yeah.
agree. Yeah, estradiol, that definitely makes it into the bag for sure.
Oh, yeah. Yeah, definitely. Like a
Well, Dr.
bottomless supply.
Yes, exactly, exactly. Million patches. It has been just a pleasure to chat with you today. Thank you so much for your expertise and your time today and just sharing with us all your wisdom. And thank you for what you're doing, because
Oh,
you're
thank you.
really, man, we need more of you in this world. So I really, really appreciate you. And we look forward to maybe having a follow up at some point.
Yeah,
And
I'd be happy to. Yeah. And
wonderful.
our social media team would be mad if I didn't tell you to come follow me at Instagram. I'm at Dr. Cat OBGYN. I try to put as many, educational videos on there. Just sharing knowledge is so very important. And so I'll often repost some posts from other physicians that are, sharing information. But I think it's really important for you as a patient, like find a voice that you like to get the information from that make sure it's a reputable source, but also just share knowledge with other women. And we need to teach our daughters like we need to change the tide, right? Moving forward,
Absolutely.
make things better for other women.
Yes, it's so true. And there will be after the podcast, there will be an affiliate link to Winona, and that just helps support the podcast. And I don't have that with me right this minute, but I will have that when you listen to the podcast. So be
Right.
well, my lovelies. Have a great weekend.
Thank you for joining me here today on the Menopause Midwife. If you'd like more information or to work with me, feel free to check out my website and book a wellness consultation at ohm406.com. Be well.